ask a question, tell us about the 4 pillars. I know about the 4 pillars. They're pretty cool.
Yeah, I'm gonna actually zoom out from that.
Okay.
So the way I approach pain is first I have to know the client's story and I need to know what it is they want. Because that may, you talk about 4 pillars, we'll get into that in a moment, but that's going to inform me of, well, this pillar is a non-discussion at this point, or they're really excited to dive into this particular pillar. And so it all starts with the client. And so for people that are listening, my suggestion is to find a clinician or a coach or a therapist who is really going to put you in the driver's seat of your care, as opposed to mandating what you do, being all diehard about things. So that's my one little side. So the 4 pillars, these are our main well-researched areas to help people reduce pain. And the first one is education. It is fascinating. We have fMRI studies showing people's brains calming down after they receive education about pain. And when you think about it, it's really not that weird. You know, if we go into a math test and we're wholly unprepared, we're probably going to be stressed and anxious. If we go into a math test and we have studied and we know the information and we've done it repetitively, we're going to be much more likely to have a success. The same is true for pain. When people understand pain, they have less pain. It's not a standalone treatment. That's super important because some people think, oh, I could just learn about it and we're good. No, because we also need, what are the treatments we need to create safety and calm in the nervous system? Exercise is a huge, super important piece. If we were to choose only 2 things, it would be exercise and education. And the reason that exercise is so important, one of the reasons, is because when we exercise, we are creating blood flow, and nerves love blood flow and movement. So if they're getting that, then they